It was a solemn weekend for many who marked the 20th anniversary of the September 11th attacks. And while Presidents Biden, Obama, and Clinton attended a memorial at Ground Zero, and George W. Bush spoke at the Flight 93 National Memorial in Shanksville, Pennsylvania, Trump, who initially wasn't supposed to appear at any 9/11 related events, ended up making a surprise visit to the New York Police Department's 17th precinct. There, he called it a sad day, then quickly went on to trash his successor and hint at a 2024 presidential run before he moved on to his day's main event, acting as commentator along with Trump Jr. for a pay-per-view boxing match on the 20th anniversary of the September 11th attacks. But that glaring exception notwithstanding, for the most part, Democrats and Republicans managed to come together Saturday to honor the nearly 3,000 people who were killed. Unfortunately, the same can't be said about the reaction to the thing that's causing the same number of deaths every 2 days across the U.S. and more than 220 times the September 11th death toll overall so far. After Biden announced broad new federal COVID vaccine mandates for roughly 2/3 of American workers last week, several Republican governors immediately started fighting back.
It should be a personal health care choice. This is not something that the government should mandate.
What the Biden administration is doing is government overreach, pure and simple.
Biden's latest COVID plan would not only mandate vaccines for all federal workers and contractors across the board, it would also require them at most healthcare facilities to get Medicare and Medicaid reimbursement. And it would mandate that any business with 100 employees or more require either a vaccine or weekly testing for everyone. The plan also includes access to those booster shots we've all heard about, expanding safety protocols in schools, and ramping up production of rapid tests, among other measures. But Republican governors aren't the only ones pushing back. There have been plenty of reports from workers across the country, including several military members who've quit or plan to quit over the new rules. And in one New York hospital, so many workers in the maternity unit have quit that they're not delivering babies there for the time being. Still, members of the Biden administration are standing firm that vaccine mandates are the best way out of the pandemic. And as for the legal issues, many experts are pointing to a century-old Supreme Court case from this state as precedent, the 1905 case of Jacobson versus Massachusetts, in which the High Court ruled that officials in our state and beyond did have the power to force individuals to get the smallpox vaccine for the public good. And if Biden's mandates hold up, they come as another large swath of Americans may soon become eligible for vaccines. Kids ages 5 and up who, many health experts are predicting, will be able to start getting their shots by Halloween. Joining me to talk about all this and more, Dr. Katherine Gergen Barnett. She's Vice Chair of Primary Care Innovation and Transformation and Program Director of the Department of Family Medicine at Boston Medical Center. William Hanage is Associate Professor of Epidemiology at Harvard's Chan School of Public Health and a member of the school's Center for Communicable Disease Dynamics. Welcome to both of you. Thank you so much for being here. Starting with you, Bill Hanage, if I can, did Biden go far enough?
Well, I want to start by saying that it's fantastic if more people get vaccinated as a result of it. That's that's the bottom line. Vaccines are not the only tool we have to get this pandemic under control and have a far, far, far better fall and winter than we would have alternatively, but they are the single most important one. And so by putting these mandates in place, if that gets more people vaccinated, that'll be really good. However, that's the key question. Is it going to get more people vaccinated? And as a result of that, I'm particularly excited by seeing the other things which are in there as well, because while vaccines are really important, so's testing. So's all of the other stuff, all of the things which are going to maintain situational awareness so we can keep on our toes while facing the virus.
Dr. Gergen Barnett, did he go far enough, Joe Biden?
I completely agree. I think that it is a wonderful hope that we can get more people vaccinated. I'm very concerned about the way in which it was done. I think we've worked very hard to build up dialogue, conversation. I think the way that the message was delivered was really about, our patience is running thin. It is time for people to get vaccinated, and recognizing that the 80 million people who are not vaccinated are not vaccinated for very different reasons. And so how do we actually think about exactly what you were saying in terms of 9/11, people working across the aisle to come up with more creative and strategic ways of communication? And specifically, in this moment, I want to turn to what happened with the HIV epidemic. In 1990, the Ryan White Act was signed by Orrin Hatch and Ted Kennedy. How can we have that kind of collaboration, that kind of reaching across the aisle that you mentioned for 9/11?
You know, I have to say, though, starting with you, Dr. Gergen Barnett, I have much less patience than I think you do and your colleague may. This has been a long time. When I hear about a healthcare worker in upstate New York who doesn't want to get vaccinated, or anywhere else for that matter, I say, I don't want that healthcare worker talking to an unvaccinated patient who will then turn to the healthcare worker and say, wait a second, you don't think it's safe enough to do. Why should I do it? So aren't there some places where it really was time for Biden to bring down the hammer, Doctor?
I feel very strongly that the vaccine is one of our best tools to get out of the pandemic. And I absolutely encourage and support people who have not been vaccinated to continue to have the dialogue with people they trust. But I am concerned that this may backfire. This kind of delivery may backfire, again, creating more walls than bridges.
You know, somebody who I think tends to agree, Bill Hanage, here is Dr. Scott Gottlieb. He was on Face the Nation yesterday. Obviously, he was former head of the FDA. Here he is.
I think the downside of this mandate in terms of hardening positions and taking something that was subtly political and making it overtly political could outweigh any of the benefits that we hope to achieve.
Is he on to something, or I'm not with him either, but are you?
Well, he's got a point, hasn't he? We live in a country where the pronouncements of a political leader can instantly sort us into non-overlapping sets of folks who are either going to agree or disagree. And I fear that this may have some of that same effect. But I want to address a couple of things that are buried under here, which is not just vaccine hesitancy or refusal. And a large part of the country, there are issues with vaccine access, which are people being able to get the vaccine, people feeling that they can take time off work to be able to get it, people worried that they might not be able to do a day of work that they need to feed their family if they have side effects. So I want to address those things as well, because those folks are at risk of not being vaccinated. And they're also very often the people who have risk factors for infection.
But I would argue that one of the reasons people still have doubts, both of you, and I'll start with you, Bill Hanage, is the hypocrisy of some of these governors who have a huge platform. I mean, we just did two, but let me add one to the list. Tate Reeves is the governor of Mississippi. Here's what he said in the last few days. What Joe Biden did is terrifying. He's stepping on the, he still believes in the freedom, from tyrants, meaning Joe Biden is a tyrant. When you have a guy like Tate Reeves, governor of Mississippi, who's been bragging for years about Mississippi having the highest vaccination rate in the country for mumps and measles, and I think it's 7 other diseases. And by the way, they don't even have a religious exemption in Mississippi, and then does this crap attacking Joe Biden. Aren't these governors the people that Joe Biden has got to take head on so that the misinformation and doubt that they plant hopefully gets countered?
I'm a scientist, Jim. I mean, I'm not a politician. I will just observe that politicians often say things for reasons which are not remotely scientific. So, and I think we can almost, leave it at that.
But if they cause people to doubt science, isn't that?
It's certainly very, very unhelpful. I mean, I would argue that if you can look at Massachusetts, for instance, I'm sure we're going to come to Massachusetts, but we're in one of the better vaccinated states in the nation, and you can actually really see the benefit.
Well, speaking of Massachusetts, Dr. Gergen Barnett, let me ask you, has Massachusetts gone far enough? And let me tell you what I'm referring to specifically. About a month ago, the governor was against masks for everybody in K through 12. Since that, the Secretary of Education has said everybody, vaccinated or not, has to wear a mask. On the other hand, there are places like Los Angeles that have said that isn't enough. Every kid's got to be vaccinated, obviously 12 and above, because under 12 aren't permitted to be vaccinated yet. Should we be taking that step to ensure that teachers, other staff, and the kids themselves are safest here in Massachusetts?
Well, I think the way that the governor has pursued the mask mandate actually sets up some of that dialogue for October. He's really said we need to have masks in school. And then if we have 80% or more people vaccinated in schools, then we can take the masks off. So I think that was a nice way for Governor Baker to start to address that. I think for those of us who are physicians and parents, we are very grateful for the mask mandate because we know that actually makes a big difference in schools. And I agree with my colleague. I think, how do we continue to talk about the other things in terms of access to testing, reliable testing, free testing? I work at a place like Boston Medical Center where it's not just about access to the vaccine, but it's really about taking that time off and having ability to get tested.
Going back to you, Bill Hanage, first, and then to Katherine Gergen Barnett, is there a point at which you'd say we can't keep talking to the 80 million people, some of whom, a significant number of whom I'm sure, have good faith concerns about this, and say that they are stepping on the health prospects of everybody who's chosen to get vaccinated, and we have to forget the carrot and start using the stick, no?
Well, I want to point out that there is this long existing notion of that there are two different types of freedom, at least two different types of freedom: freedom to do something and freedom from something. And encouraging vaccination gives us the freedom, or people in our communities, the freedom from the concern of uncontrolled spikes which put healthcare at risk. That's a really important thing. However, we have to figure out what we're going to achieve or how we're going to achieve it. And that's the thing which I would put the emphasis here. If this works and succeeds, great. If it doesn't, and it just means that some people are now saying, well, if they're going to make me do it, I'm not going to, then that's going to be much less helpful.
So, Katherine Gergen Barnett, you share the concern that the stick may not do the trick. So, is there a point at which, I don't mean a date certain, but is there a point at which you say, we've waited long enough and mandates have got to be even broader? For example, I think the fact that Joe Biden did not mandate vaccines for people who engage in interstate travel, on planes, on trains, I have no idea why that wasn't included. Maybe they were worried it couldn't be enforced properly. Is there a point at which we have to say we've given it all we have and we've just got to go for it?
I agree with you. There's no magic line in the sand where, you have to absolutely be using the stick more than the carrot. I think there's a very delicate balance that needs to happen right now. And part of what's not happening is really reliable evidence that's given daily by the CDC in a way that people can understand. And so, look, everybody wants the same thing. At the end of the day, people want to be free from disease. They want to have full lives. They want to connect to people they love. Nobody's doing this out of spite. So what's happening here? And so how can we not just say, you have to do this, you are completely unreliable and you're killing us all, and go to the other place where we say, actually, how do we work across the aisle? How do we get our leaders? And how do we put the money into communities so they can take care of their people?
I think we have a long wait for our leaders working together. We only have a minute left, Bill Hanage. You wrote a really interesting piece with a colleague in the New York Times. I literally have a minute, describing something that should be added to our toolbox that I had never heard of, source investigation, that you said was critical to Provincetown climbing out of their nightmare. Could you quickly describe what that is?
Sure. Contact tracing takes a number of different forms. And when people think about it, they often think that you find somebody who's infected and then you try and figure out all the people they might have transmitted it to and try and catch them before they can transmit. Source investigation asks the other question, where did they get it? If you don't know where they got it, then you want to find out where they got it. And this is for a lot of reasons, including the fact that this tends to transmit in clusters. So if you go back and you find that person had been in a nightclub, then you pretty much want to find everybody who had been in that nightclub, because they could well have been exposed. And that was very, very helpful in terms of Provincetown. I want to point out, Massachusetts now has a plateau of cases. Even though the daily case counts are quite high, they're 5 times higher than they were this time last year, we're having half the deaths. That's because vaccines work.
And the more who take them, the happier we will be. The question is how we get there. And for now, Dr.
Absolutely.
Katherine Gergen Barnett, Bill Hanage, thank you both for your time. Really appreciate your thoughts.
Thank
See
you so much.
Thanks, Jim.